Hello, I am Clàudia-Li Valiente and I am going to talk about my bachelor thesis, Determination of Perfusion Abnormalities in Subjects with Status Epilepticus. And well, first of all, status epilepticus is a condition that it's not very common. It affects from 9.9 to 41 people per 100,000 a year, but it can be life-threatening. It is characterized by a seizure that lasts longer than 5 minutes or a series of seizures that occur within a 5-minute period without the person returning to consciousness in between. It can lead to long-term consequences such as neuronal death or injury and alteration of neuronal networks. In most cases, it is controlled with medication, but about 30% of patients do not respond well, and they progress to refractory status epilepticus. In these circumstances, surgery is considered. And well, the most common procedure is the resection of epileptogenic focus, and the identification of this focus is normally done with EEGs and structural imaging techniques. However, when there is no structural lesion apparent causing the seizure, it is difficult to identify the focus, as EEG technique does not have much spatial resolution. And in these cases, searching for perfusion abnormalities is an interesting approach to delineate precisely this focus, as these abnormalities seem to appear in the epileptogenic focus. And while these perfusion abnormalities can be identified through cerebral blood flow maps, which can be obtained from these different imaging techniques. And however, due to the lack of radiation exposure and its higher spatial resolution, perfusion-weighted MRI techniques are the most frequently used. And well, a perfusion-weighted MRI technique is DSC MRI, which is a technique that measures cerebral perfusion by tracking an exogenous contrast agent, usually gadolinium-based. And despite being the most used in clinical practice, ASL, which is another technique, presents crucial advantages. Its principal benefit is that it uses arterial water as an endogenous tracer, eliminating the need for exogenous tracers that can be potentially dangerous. Hence, ASL is non-invasive, repeatable, and does not have pharmacological side effects. So the aim of this thesis is to set up a methodology to assess abnormalities in brain perfusion measured through MRI in subjects with status epilepticus, independently than healthy control patients and acquisition parameters, so that it can be usually used in clinical practice. Furthermore, we will compare ASL and DSC imaging techniques. And well, for that, we have available different MRI sequences of 37 patients of a basal and a follow-up state. We have T1 and FLAIR, and two different perfusion-weighted images that we are going to compare, DSC and ASL. And well, we are going to do the detection of these perfusion abnormalities in two different ways. First, we will look for perfusion asymmetries between the two brain hemispheres by computing the ratio between the original diffusion image and a mirrored version. And well, secondly, we will look for outlier zones with respect to the mean brain perfusion at a voxel level. For that, we are going to use the Z-score at the cortex of the brain, where seizures start, and then we will select those zones with higher absolute values. And well, that's all. Thank you.